utilize gait analysis as physical therapists to identify any impairments that relate to the back, hip, knee, ankle, foot. People say that after about 5 minutes of walking, 10 minutes of walking. So this gives you kind of a good representation of that walk duration, and then you can be able to kind of see when things start to break down. Super common compensation that we see in the clinic and just in the general population relating to low back and hip pain is called the Trendelenburg sign. So that indicates, if you can see, Tori's hip kind of drops when she takes a step. That's she's either got a weak glute or glute med, or she just has a problem with the sequencing of firing of the hip muscle during the gait cycle. Common knee compensation that we tend to see primarily with severe arthritis in the knee or post-op from a surgery. So as you can see that she's pretty much lacking flexion and extension excursion through the gait cycle. So it's causing compensations with lifting the heel early on the other side, and also some compensations with a little extension through the neck. The common gait compensation at the ankle that we see is called toe slap, where there's an uncontrolled descent or a less controlled descent of the toe in the ground. You get the slapping motion. It's common in post-stroke patients. If you have a weak muscle called the tibialis anterior, and then also general ankle pain. You can see this.